Good afternoon, everyone, and thanks for joining us. I will soon be turning it over to MLA Megan Degman to lead us through today's announcement. Before I do so, though, I'd like to welcome all the media that have joined us on the telephone for this announcement today and remind you that there will be a chance for questions after the remarks today from our speakers. If you'd like to ask a question after the event, please press *1 right now or at any time throughout the announcement on your telephone. That's *1 on your phone to enter the queue to ask a question. We'll be going to you after the remarks. You'll be allowed a question and a follow-up of our speakers today. And with that, I will turn it over to MLA Dykeman for to start today's announcement. Take it away.
Thank you so much. Good afternoon, everyone. It is great to be here for this exciting event. Before we begin, I would like to recognize that today we are on the unceded and traditional shared territories of the Kwantlen, Matsqui, and Katzie First Nations. I would like to introduce our guest speakers, Andrew Mercier, MLA, Langley, Jason Cook, Executive Director at Langley Memorial Hospital, Heather Scott, Executive Director, Langley Memorial Hospital Foundation, and Maria Martini, who has had personal experiences with the Langley Emergency Department as a mother, wife, and sister. We are here today to celebrate an important milestone in the improvement of healthcare services in Langley by making sure that all of our people have timely access to emergency care. Like many communities in the Lower Mainland, Langley is growing. And with that comes the need for more public services such as healthcare. By 2024, the population of Langley is expected to grow by 9.6%, from approximately 165,600 to just over 181,500. However, Langley Memorial Hospital's current emergency department was built in 1986, when it saw approximately 25,000 patient visits per year. Since then, visits have increased to more than 44,000 per year, and by 2025, demand is projected to increase to 55,000 patients per year. That would be a 20% increase in visits from 2015 to 2025 in the same physical space. Our government recognized the need to take action, which is why we moved forward with this project in 2019 and improved the extra needed funding to make that happen. Since that time, construction has moved along, bringing us to where we are today. I am thrilled that our government chose to invest in this project to further support the healthcare needs of people in Langley. We are now at the substantial completion stage of the emergency department expansion. That means that all that is left is a few touch-ups here and there, with the space being ready for patients in early May. The expanded emergency department will increase patient treatment bays from 49 to 49 from 31. There will be a dedicated area for mental health and substance use needs, including a new secure separate treatment area, as well as an increase in the number of trauma bays from 1 to 2. This will also include a separate pediatric waiting area for children and a new entrance that separates walk-in patients from those who arrive by ambulance. Also, to minimize the risk of infection, an isolation room, additional hand washing stations, utility rooms, and a decontamination area have been added. The new emergency department will be accessible from the new entrance road and new patient pickup drop-off area at the hospital. I would like to thank our partners, Fraser Health, Langley Memorial Hospital Foundation, and the Langley Memorial Hospital Auxiliary for all their support in bringing the project to a successful conclusion. The newly expanded emergency treatment space at Langley Memorial Hospital means more lives can be saved, and that is absolutely critical. And I look forward to the official opening in May. It is now my pleasure to introduce my friend and colleague, Langley MLA Andrew Mercier.
Thank you, Megan, and good afternoon to our viewers. I'd like to echo Megan's recognition that we're today on the traditional territory of the Kwantlen, Katzie, Matsqui, and Semiahmoo First Nations. It is exciting to be celebrating the substantial completion stage of this project and having doors open to the newly expanded emergency department in May. You know, when I think back to being at the announcement of construction starting in 2019 and the amount of work that's happened since then, especially during the middle of a pandemic, I am just floored by the commitment and professionalism of everyone involved. Langley Memorial serves the people of this area very well. When you need healthcare services, you know you're in good hands. This also means that healthcare workers will be able to offer critical care in a bigger space that is up to date. We know how passionate they are about helping people get better, and I am pleased that our government made sure that they have the best possible workspace to provide quality public healthcare. And for patients and their family members, they will have the privacy that they need during what can be a very stressful time in an emergency department. I join with MLA Dykeman in thanking all those who made this project a reality. Thanks to the leadership of everyone at Fraser Health, and as well those at the Langley Memorial Hospital Foundation and the Langley Memorial Hospital Auxiliary. And I'd like to take a moment as well to thank our municipal partners, the Mayor of Langley City and the Mayor of Langley Township, Val Vandenbroek, Jack Froese, and their respective councils, and to just as well extend thanks on behalf of all of us to our Minister of Health, Adrian Dix, who has made expanding healthcare in fast-growing regions like ours a priority. Our government is committed to modernizing healthcare facilities around BC, and that includes Langley. Today's announcement is another example of our government putting healthcare first for the people of Langley. In January, the first ever MRI suite at the hospital was fully operational. The MRI suite is a contribution between Fraser Health and the Langley Memorial Hospital Foundation. The opening of this suite brings the total number in the Fraser Health region to 11 MRIs. As well, I'm pleased to share that work is almost complete on multi-year upgrades at the hospital, including elevator, electrical, seismic, and nurse call system upgrades, and an additional generator. This is great news, and I'm proud that healthcare in Langley is a priority for our government. The need for an expanded emergency department was in our community for a number of years. Because of the hard work and determination of everyone involved, we are almost ready to open the expanded facility, a place that will meet the needs of the growing Langley and surrounding population and help save lives. At this time, I'd like to turn it over to Jason Cook, Executive Director of the Langley Memorial Hospital Foundation.
Thank you, MLA Mercer, and thank you, MLA Dykeman, for your great words and compliments to Langley. So today I'm very pleased to be here on behalf of Fraser Health Executive and our hospital staff and physicians here at Langley Memorial Hospital. I'm the Executive Director, and today is marking such a great day for Langley. And we are sitting here in Langley on the unceded and traditional territories of Kwantlen, Matsqui, and Katzie First Nations. So always want to acknowledge our partners and our First Nations. Today is such a great day for us. It is Substantial Completion Day. It marks the transition from our construction build and now moves us towards the clinical preparedness. And over the coming month, we'll be working with our dedicated staff and physicians through orientation and training, commissioning of all the new equipment, and preparing our brand new space for better patient experience and patient flow. Today, as we hit the substantial completion date, we are also very mindful that this is on the eve of us moving into being able to provide patient and family-centered care in a whole different way for Langley through this emergency department. That means for those needing emergency care, they will be able to come in to this building, this new facility, in a way that will expedite care to the bedside. So we have two entrances, as been alluded to, is one dedicated for our ambulances that will allow them quick access to the right level of service in our emergency, as well as providing a dedicated entrance for those coming in with their family members. And that is a big shift in providing patient-centered care. Equally as highlighted, we are so excited about the clinical advancements in our building here, a place for kids to receive care that is going to be so less scary and appropriate. all of our build here has been mindful of our seniors, our most vulnerable populations, and elder-friendly code has been applied throughout this build. So seniors will feel comfortable, children will feel comfortable. And as we highlighted earlier, equally, our mental health substance use folks coming in for emergency care will be actually have an environment therapeutic to their special needs as well. This is exciting. As we also have talked about and have been very excited, our physicians and staff with actually having a decontamination area specific to be able to keep a patient safe and our staff safe as we provide care. These are great advancements as well as with our infection control standards and having the space to do the right care. That is a great step forward for providing emergency care for those in Langley. Today, as we look forward and Mark going forward, this coming month, as we do this orientation and training, we know that the equipment that we're commissioning and this building has been made possible through the generous leadership of our ministry and the Ministry of Health, Fraser Health, and our donors through the foundation, as well as our Langley Memorial Hospital Auxiliary, and an amazing campaign that has really spoke widely of Langley's commitment to healthcare for Langley. And so we're very grateful for that. Throughout the last couple of years, we are so grateful for the partnership of Alice Dawn, who's been our lead construction company, as well as KRA Architecture. They have stayed with us and have brought us through to this stage today as we've completed substantial completion. We are also very mindful that we've had clinical leads such as an ER nurse who has been with us since master planning of this, as well as our project manager. And so these individuals, as well as our leadership, have continued to have our eyes focused on patient-centered care throughout this project. In particular, I want to be able to thank also our medical staff, our ER physicians who have been a part of this design throughout, as well as our ER staff and the staff here in Langley Memorial Hospital. This has been a huge collaboration and partnership over the last several years, from design planning right through to this very day as we now move into commissioning of the equipment and orientating our staff. We are so grateful for our physicians and our staff. They are so excited to come into this new build to provide that emergency care for the Langley population and communities around us. So thank you for that. Thank you very much. Today, we also want to be very mindful that our donors have been so generous and have been so part of making this a reality. And so we know that this has been a real testament to the community of Langley and our commitment to our healthcare. Today, I want to also thank those in the community and look forward to these doors opening in the coming month. And so to that end, we want to share with you a short video of the actual highlights of this build. So I'm very excited to share that with you now. On that, want to thank you again for your time and for your commitment to Langley Memorial Hospital, and introduce to you our Langley Memorial Hospital Foundation Executive Director, Heather Scott, for a few words. Heather?
Thank you, Jason. I'm honored to be here representing the Board of Directors, staff, and volunteers of Langley Memorial Hospital Foundation. I want to thank Megan Dykeman and Andrew Mercier for standing with us today and celebrating this huge milestone for Langley. The updated expanded emergency department will provide residents with the quality facility Langley has long needed, and where our medical staff can continue to provide exceptional and compassionate care. The significant investment made by the province of British Columbia and the Fraser Health Authority honors the strong community history, our local residents, and our great hospital staff. And Langley Memorial Hospital Foundation is proud to represent the community as a key partner in this capital improvement at Langley Memorial Hospital. Donors are the backbone of positive change. In fact, Langley's hospital was brought to life over 70 years ago, thanks to the advocacy and financial support of our community. This community spirit is a legacy that lives on today. We're so proud of the pivotal role that donors played in making this day possible. Their early and loyal commitment to healthcare has created a lasting legacy through this emergency department project that will benefit Langley and surrounding communities for years to come. Representing our donors, we at the foundation have a vision. Our eyes are on the day when our health services have the resources to fully meet the needs of Langley and the surrounding communities that depend on us for their care. Representing our donors, we acknowledge our work is far from done. Just like our ER needed updating, so too do our medical and our long-term care facilities. We at the foundation look forward to the ongoing partnership with our government, hospital, and community to realize this vision for an advanced campus of care right here in Langley. Our new emergency department is a testament to our community and the power of partnerships to ensure our patients continue to receive the best possible care. To our community and our donors, thank you from the bottom of our hearts for the important role you play in realizing this vision for urgent local health care.
Thanks very much. And thank you to all of our speakers. In a moment, we will go to questions from the media on the telephone. Once more, if you're on the phone and you'd like to ask a question of any of our speakers, please press *1. That's *1 on your phone, and you will enter the queue to ask a question. We'll be allowing you a question as well as a follow-up. Before we do that, though, oh, and once more, that is *1 to enter the queue to ask a question. Before we do that, though, we will go to a photo of our participants today. So I'd ask that each of our speakers just look into your camera, and we'll take a photo so folks can share that afterwards. And we'll do that in 3, 2, 1. Thanks very much. And with that, we will go to questions. Our first question is from Heather Colpitz from the Langley Advance. Heather, go right ahead. Your mic is live.
Thank you. So in a traditional non-pandemic situation, there would be a lovely grand opening and ceremony. How do you handle the official opening for this facility?
That is a great question. Would you like to answer that one, Jason Cook, what that might look like?
Sure. Our first priority is to care for the emergency folks coming in receiving treatment in this new great area. So right now, given where we're sitting in this pandemic, we will continue to follow fully the orders of Dr. Bonnie Henry, and any non-essential events would not be supported at this point with where we're sitting. We want to be very focused in our partnership with our physicians and staff and be able to provide the great care that we have been providing throughout this pandemic as we move into it. We look forward to a day when the community and the pandemic will be different, and I am very confident that in partnership with our foundation and our auxiliary and our ministry leads here, a time of celebration will come, and let's hope it's sooner than later.
Thank you.
Thank you. Thank you, Megan. Thank you, Jason. Do you have a follow-up? Heather, did you have a follow-up question? Go ahead.
Yes, I'll keep going until someone stops me. Okay. Probably directed at Jason. Tell me about how the project worked, considering you had to have a fully functioning hospital going on at the same time.
And great question. We have been able to do that quite well, as our build has been adjacent to the current emerge. So our challenges have been more around the noise and the tie-in to our current hospital structure. But for the most part, we've had various phases where we've had to realign our triage unit, but we have always worked with patient first. And from that perspective, we've been very successful to continue through the construction as well as through the construction with the pandemic. So it has taken a team of literally hundreds to always keep that as the priority. But thank you for the question.
Great. No one else from the media on the line has queued up to ask a question. So that is all the time we have for today. Thank you for your question, Heather. Thank you to all of our speakers and everyone. Please have a great weekend. Take care.